Welcome to everyone who has joined us today for the podcast. And I have a great and a lovely guest with us today, Ransford, who has recently passed his NCLEX RN exam. And join me in congratulating Ransford for achieving like a big milestone of his life. How are you feeling, Ransford?
Oh, honestly speaking, I felt like I had a burden on me. Now all the burden is away after I passed the NCLEX. So it's a great feeling. It's a great feeling. I've been excited for the past 2 weeks. Anytime I walk with confidence now.
I know. When you pass, there's a different, like the air changes, eh? The
Yes,
air entirely changes. You feel inside is happy, right?
yeah. And you feel like, oh, after all, what you were dreaming about, now you have been able to achieve. So it it makes you feel good. It make honestly speaking, for the past 2 weeks, I've been really happy. I've been excited about it.
Yeah, yeah. So we're gonna talk about your journey a little bit. So, what made you choose Sure Success, nursing center over the other preparation options? Was there anything specific, or just a gut feeling that you felt that, oh, I think this is the right fit?
Oh, the reason why I joined Sure Success was my first time contacting you. Uh, I was using a Ghana number, right? So I contacted you, and honestly speaking, I didn't know much about the processes. So you enlightened me about it. You told me the pathways, how to get your license in Canada. So you told me everything and even gave me some options to even choose US if I'm interested. So I felt like, oh, you are really genuine because no one can give you all those, because if someone wants to give you all this information, you have to pay for consultation fees, and you gave it to me for free. So if you have given me to me for free, why not? I have to join Sure Success. And honestly
Oh,
speaking, I went to check your reviews and I love it. I love it
oh, oh.
because when I checked, 5 star, 5 star. You saw my review? You saw my
I
review?
still have to see it though, Rans. I honestly, the team tells me that, hey, sir, there are some reviews, and I honestly like have not. I apologize to all the students, even my students who are watching it. I have never gone to check the reviews. I just when somebody comes to me and tells me, "Oh, we checked your reviews and that's why we came," I feel so happy. I feel like I just want to hear it from someone else.
Yeah.
I think I should. I'm going to check your review for sure.
Yeah, because during my review, I initially put more than like 12 or 15 stars because I wanted to give you
Oh,
extra.
oh, you are so sweet, Ransford.
I wanted
So,
to give you extra.
oh, I am so glad that our program worked for you. Our goal is actually to help the internationally educated nurses, like empower them and help them become successful. Because I feel like when you became successful, when you are successful, you have achieved your dream. Internally, whenever I see a message from the team or I get a message, my heart is so full. Wow. I just feel wow. And I feel like God has given me this opportunity where I am able to celebrate the success of every single person
Exactly.
who I was able to participate in their learning journey. So I feel like every single time you guys are passing, I feel like I have passed my NCLEX again.
Yeah,
So
exactly. Exactly.
that's it. So we're going to talk about the study tools. What do you think? What tools or strategies from the program helped you the most? Like, was it the live classes, like the questions, the mnemonics, or was there anything that really surprised you? Like, oh, I've never seen this.
Honestly speaking, I'm not fan of mnemonics. I'm
Me
not fan of
neither. You know me. I say it in the class a lot.
I'm not fan of mnemonics. So if you tell me to memorize something with mnemonics, honestly, I'm going to fail. I'm going to fail.
We are same. Rans.
So
Yeah.
so what helped me was with the content, because you elaborated more on the content, and also it also opens up your mind because some of them you already know, but with for instance, I didn't practice like for a long time. It was just a year. Then I moved over to Canada, so I couldn't get enough time to practice. So since taking this up, when it gets to clinical questions where it involves, I was finding difficulty over there. So because you have been practicing and you were giving examples and everything, I was like, oh, surely, surely I'm getting there. I'm getting there. I'm getting there. So one, the reviews, the content review, superb.
Oh, thank you.
And two, how to answer the questions. Oh, honestly, I loved it because although I could answer questions at times, it's like, oh, I did this in school, so let me answer. But when it got to the critical skills and where you have to apply the uh, some places you can't apply common knowledge. You have to know it before you can.
Yeah.
But as I joined, or how to answer questions, it really helped. It really helped
Yeah. Yeah.
because one thing I like about the classes was that after the content review, you have a special time to answer questions. That
Yeah.
one, I never miss that. I never miss that
Yeah. Yeah. No,
because
I can like. Mhm.
at times through that you don't know something, and it also helps you. I remember this one, GT power one example. Then you
Mhm.
asked me, Ransford, why did you get that wrong? And I explained that, oh, this is what I was thinking. You told me, no, this is how we do it. So with
Yeah.
that one, you have corrected me, and it's going to score me an extra point. So through
Yeah.
the classes, it was like sharing ideas. And with these classes, if you get your answer wrong, no one is going to punish you.
Yeah.
So if you don't know it, ask,
Yeah.
and surely they are going to answer that for you.
Yeah.
So that's what I like about the classes.
Oh, that's so nice to hear. And how were the resources? Like, how did you find the resources on the website, like presentations, and like the other questions and stuff? How was your experience with that?
One thing is, if you rely on the resources alone, the resources is like a brief. So it's like doing a presentation. You give a summary, then you explain. So my I would say that although you give us the notes and everything, but the explanation was the key.
Yes,
The
that's right.
explanation was the key because
Yeah.
if you try to, if they write something there, there are more explanation behind that point.
Yeah.
There are more explanation behind that point. So I think if you rely on it, you have to
Yeah.
content and the resources. You have to
Yeah.
balance them. If you rely only on one, I think that was not helping. So you adjust the two and snap. You just pick it up.
One thing I can add there, Rans, is that the presentations are the ingredients,
Yes,
and we make it the recipe,
exactly.
and then we present it to the students. So I often say that sometimes to students that you get the presentation, but like there is highlighter and points, and those 60 slides that we're going to teach in the class, those 60 are going to become 100 or 200, because most, like Alvin and I have been teaching for so many years,
Yeah.
and with experience, every single point. I think with me, one thing you must have noticed, like I am all about vocabulary. I will always be like, okay, Google this word, find out the meaning.
Exactly. Yeah, I remember. I remember. I remember.
So the recipe is when we come and teach the students. So did you feel like that there was like a team behind you throughout the process, and how did that impact your mindset and confidence?
Uh, I would say anytime we wanted to get access to you, you are readily available to answer any question.
Oh, that's so
You are
sweet.
readily available to answer any question. So I remember I once called you and told you I have been suffering from this ADHD because at times I could be doing something and then I just switch and do something else.
Hmm.
So through your advice, how to go about it, that's how it's supposed to be because some people they just take their money is you come to the class. If you don't come, they don't care. But you and your team, when we just ask you any question, you are there for us. So that's
Oh,
one thing because you made us feel some bond between the students and the team. That
yeah.
is one thing I like about it.
Oh, thank you, Rans. So, how was the feeling when the pass showed up?
Oh, honestly speaking, that was my third time.
Yes.
So my first time, I called you and told you I did 150 questions. So the 150 questions, I had no belief in myself because I didn't study hard for it. I just went to try and see how it was. So the second one, I did 87 questions. After I after I finished the last question, I felt that I failed because I knew how because mostly they'll tell you when you want to pass, you get the hard questions. But with the 87 questions that I got, they were so easy. So I knew I failed. So with this third one, when I went in, as I did 100 questions. So as I bypassed 85, I was like, not again, not again. Then when I got to 90, thereabout, then I started getting prioritizations, delegations, and SATs. And the questions became very difficult. I remember my last question. I've never even heard that question before. They told
Yeah.
me if someone is allergic to iodinated salt, which drugs which drugs are not supposed to be given to the person, like it's contraindicated. And they gave me options. And honestly speaking, I've never met this type of question before. And I answered it and it went off. So when it went off, I had some smiling face, but I just wanted the board to confirm. So it was I wrote the exams on Saturday.
Yeah.
So
Oh,
Mon-
wow.
Monday morning at 9 a.m. I got an email.
Yeah.
Congratulations. Then I just smiled. I said, finally, my wishes have come true.
Got it.
Yeah.
Got it. Yeah. So, and like for friend to friend advice, if your close friend is stressed, what would you honestly tell them about your experience with us? What would you, or just your experience in general for NCLEX, what would you like tell them?
Yeah. I would say I'm the type of person I never get discouraged about something. When I get discouraged, that means I'm quitting. But I said to myself, I'm a fighter. I'm not quitting any moment from now. Even if it takes me 10 times, I'm going to still register for 10 times because I'm not quitting. So I made up my
That,
mind that mostly the board, they mostly give, at first, most of them used to give three options. Like you are
yes.
given the
Yeah.
chance, three times chance. So I made up my mind. Maybe they've given us unlimited chance for some number of years, but I'm not going to do that. I'm trying to use that three times, that three chances to get it. So I did one, two, and as you are writing, you gain experience. As you are writing, you gain experience. For instance, I would say my first and second one, it was test anxiety.
Oh,
Test
okay.
anxiety, yeah, because when I get there, I feel like, oh, I want to pass, let me pass and let me go. But so I felt that it was, but with the third one, I made up my mind as I'm going all in. I made up my mind I'm going to pass. Although I don't know the type of questions that I'm going to get, but at least with what I've done with the rationales, and also I would say my focus was not on the correct answers. I mostly focus on wrong answers because wrong answers they give, and honestly speaking, it helped me because I didn't focus much on correct answers because it's like I know correct answers. So wrong answers, that was where my focus was. And I try to make sure I just remediate it and just get it correct. And anytime I get a question wrong and I just read the rationale and I read the question again, I don't miss it. I don't miss it.
Nice, nice. That's a very good strategy, Vance. That I feel like even in the class when we used to do it, I remember, I hope you remember that when you guys are giving me the answer, I'm like, I know you guys picked one. Tell me why not two, three, and four?
Yes,
Yeah.
yes, yes, yes,
It's everything is in the reasoning, everything is in why is this. And I think the strategy for the student should always be, and I think in the classes I repeatedly say that the focus is not which one is right. Don't look for the right one, find out why B, C, and D are wrong.
yes,
Once you find why this is wrong, the correct one is going to pop out,
exactly.
right? So, what is one thing that you think every student should know before they begin their NCLEX preparation as an internationally educated nurse? Like, what is that lesson that you have learned over this, journey?
Oh, I would say the type of practice and the type of curriculum we use back home is different from the Canadian and the American system. So if you want to practice as a nurse, and also because we are internationally educated nurses, I'll say that make sure you know the content first. Because when you know the content, there are some practices that we do back home that is not done over here.
Yeah.
So if you have been doing something at the ICU or the emergency room and it works back home, that means it's not going to work here. That's how it is.
Yeah.
So you have to adjust to the system over here and the curriculum over here to get used to. So I, for instance, when I started with it, I tried to just use back home answers to just, and I was getting it wrong.
Yeah. That
But
happens a lot. Yeah.
as
Yeah.
time went on, then I knew that this is what they want from us.